Hi, I'm Dr. Palumbo. Thank you for viewing some of my channels here at VidScripts. I appreciate the opportunity to be your doctor, and thank you for choosing me as your orthopedic surgeon. I'm Dr. Brian Palumbo. I'm an orthopedic surgeon who specializes in hip and knee reconstruction or joint replacements. I practice at Florida Orthopedic Institute. My educational background consists of medical school at University of South Florida. I also attended a orthopedic residency at University of South Florida. I then attended a hip and knee reconstruction fellowship at Harvard in Boston, where I returned. I then returned back to Tampa and joined Florida Orthopedic Institute, where I've now been in practice for about 5 years. I specialize in hip and knee replacements, and specifically, I specialize in revision or redo operations of failed hip and knee replacements. I also have interests in partial knee replacements, as well as custom knee replacements. I'm very passionate about what I do. I take my career and profession very personally. I spend, frankly, a lot of my free time doing things like research. I spend time in the field of implant design and development, and I look at every patient like they were one of my own family members. And I wouldn't do to one of my patients what I wouldn't do to a family member. So I view my practice and the way I approach treating patients very personally, and I have a great passion for it. Generally speaking, patients who seek my area of expertise ranges somewhat widely. It can be a simple matter of an acute knee pain or hip pain that has only been ongoing for several weeks. That patients may also have very problematic or painful or infected joint replacements, which require a much more complex solution. So the range varies rather dramatically. Generally speaking, most patients will have hip or knee arthritis, have maybe exhausted some of the more traditional conservative treatment options for that, and then on the side of complicated or failed joint replacements, again, patients are usually looking for a solution in that regard. For your first time visiting with me for a complaint such as knee or hip pain, the ways to prepare for your visit, one would be just to have a list of your medications, have a good knowledge and understanding of previous health conditions, understand that when you come to the office, most likely we will get an X-ray and take some basic information and ask you to fill out a questionnaire form. If you're coming to visit me because of a failed, painful, or infected joint replacement, hip or knee replacement, there are some basic information that I would ask you to bring. Number one, the operative report from the hospital that you had the procedure performed at is very important. If you can obtain the implant records, that also is quite helpful. Any laboratory data such as inflammatory markers, if you've had a knee aspiration or a joint aspiration, the results of that. Cultures are all very important. And then, of course, any previous notes from the physicians who treated you previously can be very helpful.